So this is for active range of motion of the hip. So you'd ask the patient to bring their knees towards their chest for flexion. For adduction, you would lift one leg of the patient and ask them to cross the other leg underneath it. For abduction, you would ask the patient to bring both legs one by one as far away from them as possible. For internal rotation, you would bring the patient's knees to 90 degrees and ask them to bring the heel inwards, and for external rotation, you would ask the patient to do the opposite. Then for extension, you would move the patient onto their front and ask them to lift their leg up. So for the functional test for the hip joint, you would first off do a single leg stand, which uses the muscles gluteus maximus and minimus, your abdominal muscles bicep femoris, psoas major and sartorius. Then you'd move on to a squat, which uses the gluteus maximus, bicep femoris, semitendinosus and semimembranosus. And finally, you'd want your patient to perform a lunge, forward lunge, which uses your gluteus maximus, adductor muscles, hip flexors, which all stabilize the hip. So for passive range of motion of the hip, you would first off test flexion by pushing their knee towards their chest. For extension, you'd bring the patient's leg up whilst holding underneath their gluteal folds. Then you would test internal and external rotation of the hip. Then you would test abduction and adduction of the hip. And then you lift this one up. Yeah. No, great. So this shows resisted testing of the hip. And then just fucking... Yeah, resist like that. Yeah. And then, no, we do adduction first. So just pull your leg in. Yeah. And then, right. And then push it. Push leg up. And then fucking... Shit.